Hey, this is Dr. Jones with Advanced Family Eyecare. Once again, I just wanted to do a little video to update you on what we're doing, what's going on, just try to keep you up to date to what's going on at our practice. We are open. Once again, we've reviewed the recommendations from the Utah State Health Department, and we can operate safely within their guidelines, so we are going to continue to do so for the time being. We are incorporating social distancing practices as part of what we're trying to do to keep ourselves and our patients safe. So just be aware of that. When you enter, things will be a little bit different. Number one, we're limiting the number of people that are in our office at any one time, so appointments are being spaced out a little bit more. We would encourage you that if you show up for an appointment, number one, only those individuals with appointments and maybe a guardian, or if somebody else, a companion to help somebody, should show up for the appointment so that we can keep the number of people in our office at any one time limited. Number two, when you show up for your appointment, call us and let us know you're here, and we will have you wait in the car until we can get you right into a patient care area. Once again, we want to limit the contact with other individuals to limit any potential spread of the virus, and so that is something we'd ask you to do. I will be wearing some personal protective gear. I've never done this before, but I'm going to start. So I'll be wearing gloves, I'll be wearing a mask. I'll be in fairly close contact with you, so for your safety and for mine, we're just going to be wearing a little personal protective gear. It's a little bit different for me. I really like a lot of personal interaction, and so that's kind of strange, but I think it's wise right at this time. As we mentioned before, sanitation issues are taken very seriously. Every room is being wiped down incredibly well after every patient encounter. And so we're making sure everything is safe that way. We're going to be asking you a few questions as well. Hopefully, if your appointment's today, you'll see this when you show up for your appointment. If it's in the future, this will be emailed to you, and it's just some questions we need you to ask. We need to ask you and then have you answer, and then sign at the bottom that everything, so that we can all keep each other safe. They will be, have you traveled in the last 10 days? Have you flown, and if so, where? Have you had any of the following symptoms? A dry cough or a fever over 105 degrees, we're going to ask you to reschedule if you have, so we're going to be asking you that. Have you had any close contact with anybody who's been diagnosed with the COVID virus? If that has occurred, we're going to ask you to reschedule. That's not a problem. We just, for everybody's safety, that's going to need to happen. And number two, would you rather wait? If you'd feel safer waiting, we understand that, and we want to accommodate that so we can reschedule you. If you're worried about not having enough contacts to get through, we'll handle that. We'll get you some contacts to get you through till when you feel more comfortable having an exam. So those are the major things that are going on. Once again, we are open, and we're taking every precaution to keep ourselves and our patients safe. And so let us know how we can help you. Once again, if you have any questions, please call. Our office phone number, 801-798-5341. You can call me on my cell phone, 435-660-1188. Let us answer any questions you may have, make you feel comfortable, and just help you in any way we can. Stay safe, stay well. Let's all be smart. We'll get through this together. Thanks, and I look forward to seeing you and caring for your eyes.